And Erin, thank you so much for generously offering to present some of your work. And Erin is going to present a PowerPoint, and then hopefully we'll have a conversation. So Erin, the screen is yours.
All right. Well, thank you so much for the invitation to talk about my work. And yeah, I've got a lot of images, so I'm just gonna be sharing my screen the whole time. So you guys can see what I'm looking at here. Okay. All right, so the title of my talk today is Taking the Venereal Out of Venereal Disease, the 1930s Public Health Campaign Against Syphilis and Gonorrhea. So late on a Monday evening in 1934, the Columbia Broadcasting Service made a last-minute decision to censor the health commissioner of New York State, Dr. Thomas Perrin, who you see here. And they censored him from a national radio.
There's no image. There's no images up. It's not coming up.
Okay.
Did you share screen?
I did share screen. Let's try it again.
Yeah, because I was seeing it.
I'm not seeing it. Did you make her a co-leader?
I did, co-host, yeah.
There's nothing.
Yep, I see it.
Wow, I don't see it. That's really weird.
Weird. But Carol, you do see it.
Yes, I do.
Okay. Huh.
I have it.
Ah,
And Amy,
Okay.
do you see it?
Yes, I do see it. Yeah.
okay,
Okay.
sorry. I'm
okay.
pulling out, but I can't figure out why it's not showing up here. Okay.
Huh.
That's okay. Let me also, I can put a link in the chat. And
There you go, yeah.
The images I'm going to be looking at. So it should be pretty easy to
Okay.
follow along with me if for some reason it's not.
Okay.
showing.
Thanks, Erin.
Okay, no problem. Okay, so 1934, this guy here, Dr. Thomas Perrin, he's censored from a CBS national radio broadcast. And they censored him because he wouldn't remove the word syphilis from his talk about what he'd been doing as health commissioner in New York State. And they played music instead for the audience. In the wake of this incident, the New York Post published a scathing criticism of this action by CBS. They said, someone ought to take the radio executives by the hand and gently break the news to them that the dear, sweet, smirking Victorian days are dead. We have reached the stage where we can hear the truth without falling in a dead faint, and we are as anxious to fight one disease as another. Many other commentators at the time also highlighted the hypocrisy of the, quote, false modesty at the root of this act of censorship. Avoiding public and frank discussions of venereal disease control in the name of propriety and morality only made an already serious problem worse, they argued. See a bit of that idea in this poster here about, shame can be a real roadblock to your health. And this era at the early 20th century, syphilis was estimated to affect more than 10% of Americans at some point in their life. So you see that stat reflected in this poster here. Related to gonorrhea, about 2 to 4 times as many people were thought to have that at some point in their life. These illnesses, often undetected and untreated in this era, could result in paralysis, sterility, blindness, and other very serious complications. And I should say that this is an era before antibiotics are a known treatment for syphilis or gonorrhea. In spite of the prevalence and seriousness of these illnesses in the US, venereal disease, or VD, and I'm going to be mostly using the historical term in my talk, VD had often been a taboo topic because it was associated with marginalized groups such as Black Americans, sex workers, sailors, and the working poor. And many connected these illnesses with immorality or hypersexuality. When the issue was addressed, it was couched in euphemisms such as, quote, social hygiene or moral hygiene. The negative meanings attached to these illnesses also promoted disinvestment in public health efforts to control them, having a direct effect on people's health. However, there are indications of change in the mid-1930s. including support for Perrin in the wake of the radio debacle, and also his appointment in 1936 to the position of Surgeon General of the US Public Health Service. During the 1930s, VD control became integrated into the everyday lives of Americans in an unprecedented way. People saw posters, these are a couple here, about venereal disease in places like libraries and schools, on the subway and on the bus. The topic appeared in popular magazines and in newspapers. Across the nation, people attended productions of the Federal Theater Project play Spirochete. That's advertised on the left here. People also went to the theater and they saw a big Hollywood film in 1940 called Dr. Ehrlich's Magic Bullet. This and the Spirochete play both centered on the history of syphilis and the big discoveries that now allowed modern control of these illnesses. In 1934 and 1940, we have the New York World's Fair, and they have a number of exhibits on syphilis and social hygiene. And so millions of visitors passed through and viewed those also. There's not only a new openness about discussing venereal disease, but also changed attitudes specifically about the role of the state in developing a more robust public health program. Polls in the 1930s and 40s revealed that large majorities of Americans were supportive of premarital testing laws, government clinics and education, free testing for anyone regardless of their income, and massive appropriations to make public health programs possible. Here's an infographic from the 1930s. They really loved infographics in the 30s, by the way. It's a real moment for infographics. And we see some of these sort of aspects of public health control indicated here, such as the routine tests and treatment and education, stuff like that. In 1938, Congress unanimously passed the National Venereal Disease Control Act. Seems pretty wild to think about Congress passing something unanimously, but they did. And this law appropriated up to $3 million for anti-VD public health measures, increasing funding each year. In 2021 money, this is about $60 million, which may not seem like that much to us, but remember that the 1930s is really when federal spending is kind of starting to happen. So this was actually quite a large amount for the time. Okay, besides this federal funding, many states matched or superseded the federal funding, resulting in a large expansion of VD control infrastructure. The changed visibility, popularity, and scale of VD control was part of a concerted effort to, quote, stamp out syphilis, led by Surgeon General Perrin and the US Public Health Service that lasted through the end of World War II. So what I want to explore today with all of you is how and why this shift happened, you know, that syphilis was something that was more censored and kind of shameful to something that, you know, people were seeing posters about at school or in the factory. So, you know, how did VD control advocates really sell this to people? How did they convince them it's something that's important, it's something we need to talk about, and also it's something we need to spend a lot of money on because there's a lot of money being thrown around. So why is this a good investment? The other thing I want us to think about is also, was this, you know, anti-syphilis campaign successful? You know, their goal, of course, is to sort of change people's thinking about venereal disease and also, you know, extend care to people in an effort to control syphilis and gonorrhea. But do they do this, right? Do they meet those sorts of goals? And then, you know, as Peter said at the beginning, ultimately, we're interested in these questions to help us think through things today, right? Like ultimately, what gets people to change their behavior, what gets people to want to spend tax dollars on things, what are some of the biggest roadblocks to people being healthy? So those are some of the big broad questions that we can also think about here. Okay, before I get into some particulars of the program, I want to just say a little preemptive thing about this guy here, who's going to be a main player as I'm discussing more about the campaign. And And I'm going to be talking about a lot of really good things that he did, ways in which he is trying to sort of challenge stigmas and stereotypes and provide more, medical care for a lot of Americans. But I also wanted to say at the top that he did a lot of unethical things and a lot of things that were harmful to people both at the time and also have had a really harmful legacy. So, as a public, we're kind of vaguely familiar with the USPHS syphilis study at Tuskegee. There's a lot of public misconceptions about it, but this was where the US government prevented Black men who had syphilis from obtaining treatment, and then also lied to them about their status for over 40 years and their care during that time. And so this started before Perrin was the Surgeon General, but he continued it during his tenure. Obviously, he knew about it during the 40s. He also oversaw projects in Guatemala where they literally did give people venereal disease. So I wanted to say that at the top to say we have to keep these things together, right? We have to hold them at the same time. That on the one hand, I'm going to talk about some things that I think he did that were positive, but also at the same time, when he's Surgeon General, there are these, unethical things that he was a part of and approved and were happening. That's not going to be my focus, but, that's an important part of this history also. Okay, so to start off, I want to talk about what sort of the main guiding strategies are for this national campaign against syphilis, and then later they sort of incorporate gonorrhea as well. So the main emphasis was to routinely test every American for syphilis, and then cure people or render them non-infectious through a full course of chemotherapy, which they referred to as in this time often as a chemical quarantine. Treatment for syphilis in the 30s, again, were pre-antibiotics being used for syphilis. So what treatment means at this time is about a year of weekly injections, primarily arsenic and heavy metal based. And as you can imagine, there are some unpleasant side effects for some people with, going through this treatment. And also a year, maybe more sometimes, of weekly injections can be very difficult and costly to complete. But that's sort of what we're dealing with when we see in these posters and these other things we're going to look at when they're talking about regular treatments. That's what it would entail for somebody in this time period. Yeah, and this was something that the campaign really focused on and thought, that this was sort of one of the main hurdles, was that people might start their treatment and sort of never really finish it. And so that was a big message that we'll see in some different materials. This focus on a federally led program based in widespread testing and this idea of a chemical quarantine is a pretty big shift from previous approaches that focused more on physical quarantines, targeted marginalized groups that were thought to, be sort of reservoirs of syphilis. And also previous efforts tended to rely on local government or on voluntary organizations. So the fact that the federal government is kind of getting more involved, that they're sort of casting a wide net with their testing, and also that they're not focused on physically quarantining people. These are some new things in this time period. So there are a number of reasons that syphilis control gained some momentum in this era. Of course, Perrin becoming Surgeon General, and this was sort of his pet issue. So he's bringing a lot of attention to it. That was a big part of it. But also I argue that it is related to other broad changes that are happening in this era of the 30s. And then I'll talk a little bit also about the war years too. So the campaign, as we'll see as we look at more posters and pamphlets and stuff, they're tapping into real concerns that people had at the time about family and social stability, the health of servicemen and workers, and also economic performance. And so these are things that sort of hit home with people in the midst of the Great Depression and also during wartime. There's also an increased interest in social planning and state interventions in this era. So we see that, in the syphilis campaign, but also, this is when we have our first national social welfare programs, enacted by the New Deal. The movement for birth control is, of course, gaining steam. Eugenics is popular in the interwar years. So we can also sort of connect some of the interest in this with some of those other developments as well. Okay, another reason I think that VD control is getting more sort of support and attention in this era is that the images and the themes that were used by the campaign that we're going to look more at are trying to move the issue away from sort of sex and morality, and they're trying to minimize some of the more controversial things that reformers felt had been holding back this type of work earlier, or making it kind of too controversial, stuff like that. So Perrin and his partners really wanted to make syphilis an infectious disease that was like any other infectious disease. It wasn't special just because it was sexually transmitted. And also they really wanted to convey, or sort of change people's thinking to say it can affect anybody, right? We're sort of getting that image on the left here where these people waiting in line to get tested, we see black and white, we see men and women, we see a guy in overalls, and we see, a guy in a tie. So they're trying to sort of move the image away from earlier kind of stigmas and stereotypes and stuff like that. Ultimately, the campaign emphasized that the strength of families, communities, and the nation depended on cooperation between the government and citizens to eradicate these illnesses. Okay, so let's get into some of the imagery, the themes, the arguments, the rhetoric that they're using to talk to people about venereal disease. So a lot of these materials are focused on the social and economic costs of ignoring VD and emphasize the benefits about being proactive about controlling it. So rather waiting until, you've been sick for many years and then you're developing some really serious complications, take control of your health, right? So children with congenital syphilis, broken families, workers disabled by venereal disease, and those impoverished by medical bills became symbols of continuing along the path of quote unquote false modesty. In contrast, images of cheerful workers and families were associated with not only health, but also knowledge about these illnesses and participation in the anti-VD program. And of course, we see that in both these images here on the left with sort of the happy mother and child, and then on the right with the family, right? For the guy who took his shots every week, he's happy with his family, versus if he didn't, he's all alone and he's had some health complications. This sort of idea, and the images of the happy families and workers and stuff like that, it reflected a confidence also in modern medicine that if you, follow doctor's orders, if you, get your treatments, everything will be fine. And this is something that's not only in the campaign, but was in sort of pop culture at the time. There's a lot of interests in sort of Hollywood movies and comic books and books that are about heroic scientists and sort of the great discoveries of Louis Pasteur and those types of guys. And I mentioned before, the Federal Theater Project did a play called Spirochete. And so here's another poster for that play on the right here. And in the play, they started off in 1492, and they sort of talked about, a long time ago and how ignorant everybody was, and isn't that sad? And then in the play, they detailed some of the big important discoveries that people had made at syphilis control. And so, getting at this theme of like the heroic scientists and discoveries that now have led us to the day when we can stamp out syphilis, that sort of thing. Yeah, sometimes they are using fear or melodrama or sort of scary stats and stuff like that. But ultimately, I think a lot of the messaging is fairly optimistic, about you can have a happy family, or, on the left, look at these, doctors and nurses leading the way and stuff like that. So there is a lot of sort of trust and optimism about the benefits of science and medicine in these materials.
Yeah.
Okay, another interesting aspect of these materials is that they took a lot of effort. They took up a lot of space in pamphlets, in movies, to really explain in clear language different principles and sort of medical procedures that were part of these efforts to control syphilis and later gonorrhea. So here I'm showing you some photographs and some captions from a government pamphlet on syphilis. But these sorts of images were repeated in lots of posters and movies and sorts of things. So like, showing the blood being drawn. And then the caption here is explaining, it's as simple as a smallpox vaccination. There's a lot of repetition of this image of, the test tubes and sort of explaining how a blood test works for syphilis and stuff like that. And they're doing this in part because I think one of the principles of sort of the New Deal was like, if you give people information, they'll make the right decisions. And so I think partially they think if we explain to people why these are important, that it's not scary, what's going on, then we'll get more people to get tested and to get treated and stuff like that. So there's a lot of basic sort of information they're sending to the public about what they would expect if they went into a clinic or to their doctor to get a test or something like that. Okay. They also are using a lot of germ iconography and, again, playing into that idea that this is not sort of a moral problem and sort of focused on what some people might see as like the immoral actions of people that lead to this. So they're really pushing this idea of like a germ causes this disease. It's like tuberculosis or scarlet fever or these other things that, as a society, we've already been trying to fight and maybe putting money towards. So it's sort of shifting blame. Sometimes germ imagery is used like you see here, where it's a little more like these ones on the right, where it's kind of like a microscopic view of the spirochetes, the germs that cause syphilis. Sometimes they're anthropomorphized. So here are a couple of examples of that. On the right-hand side, we have these little weird germ goblins that are sort of chasing this serviceman around, trying to infect him. On the left, on the right, these little corkscrew guys. This is an illustration from a book for children. And these little corkscrew spirochete guys are invading a body. So they're coming down these ropes to infect, this body. And actually, the idea that germs caused syphilis was one of the, according to, polls that they did at the time, this seemed to be one of the most like concrete messages that people took away, at least in the early years of the campaign. One of the a survey I looked at was from 1938, so that's kind of early on, but that was one of the big takeaways, was like a germ causes this illness. Okay. Campaign materials also put a lot of emphasis on the idea that the negative effects of syphilis don't just affect an individual, but they can impact the whole community negatively. And so this helped legitimize a stronger role for government in the program and, why we should spend tax dollars on this, right? It's not just an individual problem, it's a problem of the whole community and really of the nation, right? Ultimately. Workers who developed complications with motor skills might not only lose their job, but also decrease industrial efficiency. Again, this is a big deal in the midst of the Great Depression, or also harm other people at work if they have an accident, due to advanced syphilis. Also, a sick worker not only failed to be a proper breadwinner for his family, according to, campaign rhetoric, but also became another person that would be added to the relief rolls or committed to a public institution for the blind or the insane. So this is a payroll insert. And as we see here, they're saying all taxpayers are paying for syphilis, whether they know it or not, right? Because you're paying for it in all these other ways. So that was a big part of the rhetoric for sure, was if we're proactive, we'll spend less money, testing people and stuff like that, rather than waiting for people to get really sick. The rhetoric that tied illness to the whole community and economic concerns helped justify a dramatic expansion in government infrastructure and resources for anti-VD efforts in the 30s. Federal funding helped subsidize testing and treatment for all Americans, regardless of socioeconomic status, and whether they saw a private physician or a public clinic. Sorry, I skipped a page. Be distracted by my images. Here, I just wanted to show, they get into a lot about poverty in sort of the rhetoric of the campaign, like speeches Perrin is giving at the time, writings he's doing. But connecting poverty with illness is a little more hard to represent in like a poster with like a one-off image. So again, they kind of go to infographics to talk about a lot of this stuff. This particular infographic here is from an article Perrin wrote talking about high rates of tuberculosis and syphilis among Black communities. And so we can see here that there's breaking down, tuberculosis rates by class and showing, lower income people have higher rates. It's doing another thing here that is a little more subtle, which is showing that, if we look at the low income house for the white group and then the Black group, sort of the quality of the home is not as good for the representing the Black community here. But this was something he got more into in the text, but is sort of hard to represent visually. But he talked a lot about how Black people are sort of overrepresented among low income people, and therefore, they have higher rates of disease. This was very typical of other sort of white New Deal progressive people at this time, sort of making this really a class issue, and I think in an attempt to sort of take away the stigma, that there was on the Black community for these sorts of health disparities. But one of the problems is that Perrin doesn't really get into a lot of the more get into racism in more detail. So when you look at, Black commentators at the same time, they're talking about segregated medical facilities. They're talking about, that in the Deep South, there's like no money for public health. And, a lot of low income Black people are relying on public options for medical care. They're talking about the fact that there are no professional opportunities for Black doctors and nurses and stuff like that. So Perrin is not really getting into all of those intricacies, even as he is trying to sort of explain why we should invest in, public health stuff that's going to reach Black communities, and explaining some of the context for high rates of disease, among Black people, but limitations, of course. Okay, so because there was a lot of focus on thinking about how poverty contributes to ill health and, how this is really a community issue, they took an approach that actually we kind of saw with COVID, which is they really encouraged people to go to private doctors to get tested or to get treatment or things like that. But they also were really clear that if you can't pay, there are subsidized and free options. You can go to, a free clinic or something like that. So we see those sorts of things represented in this poster here, go to your private physician, but if you can't, here's where you can go. And they did, federal money did go to building, setting up more clinics for syphilis as well. But they really didn't want to make doctors mad, because doctors, organized medicine was really sort of the biggest opposition to any sort of expansion of public health stuff at this time. And so they sort of did this as a compromise to, hopefully not have a lot of objections from organized medicine, that people could go to private physicians or public places to get these subsidized or free blood tests or treatment and stuff like that. The focus on families also shaped another really important control method that they're enacting in this time, which is premarital and prenatal testing laws. So they start kind of passing them in the late 30s, and they're really successful. So this map here is showing us 1944 and premarital syphilis testing laws. So by 1944, in 30 states, so those are the ones represented in black here, all of those states required both men and women to have a syphilis test, and then they had to bring that proof to get their marriage license and get married.
They do it.
Yeah, and so the states in white on this map didn't have any sort of requirement, and then the states that have patterns on them had sort of a half-hearted requirement, which is the sideways stripes required only a groom to have an examination, and then the ones with little dots on them, you basically just had to say officially that you didn't have syphilis when you got your marriage license, but they didn't test you or anything like that. So this was something that, as you can see, you know, a lot of states passed these laws. There was quite a bit of popular, you know, support for them. And then also about a similar number of states also passed prenatal testing laws, which require doctors at the first prenatal exam with a pregnant person had to test them for syphilis. And so this is sort of interesting because we might sort of take this for granted. Blood tests are sort of whatever. We get them all the time, kind of now in modern life maybe, but this was sort of the first kind of widespread blood test that people would have encountered. So this is something that would have been kind of new for people to have to go through this sort of thing. Okay, another aspect of the program was really encouraging industrial VD control programs. So the government didn't require factories or businesses or anything, but they really encouraged employers to test all their new applicants over time, try to test, you know, all of your employees, to provide treatment or referrals for workers who tested positive for syphilis, and to create really robust education programs for in the workplace. So there was a little bit of opposition to this, just in terms of like, will I be fired and confidentiality and stuff. But typically sort of as they're carrying these out on the local level, they tried to work with unions and stuff like that to really reassure people, you know, they will be confidential, it won't affect you won't lose your job, stuff like that. As we get into mobilizing for war, they're still really hitting the family and the worker kind of themes and iconography. They're just sort of adding like a dash of patriotism to it. So it's not just, you know, don't just get tested or get your treatment in order to protect your family or to make sure your factory is efficient, but also now to make sure, you know, you're helping the nation and you're helping to win the war efforts and that sort of thing. Okay, while these different approaches that I've outlined definitely increased access to healthcare for many Americans, there are some limitations to talk about. So in particular, the symbols and the rhetoric used by the campaign avoided some of the more difficult and controversial issues related to the control of venereal diseases, such as condom use, which they don't ever talk about to civilian audiences, extramarital sex, child abuse, racism. So these are a lot of things that, of course, complicated, you know, controlling venereal disease and made, you know, discussion of it more uncomfortable, but also were important. And so, you know, they're trying to sell it to people, but also it meant they couldn't talk about certain things or use certain strategies that would have been useful, such as condoms, of course. Okay, when they're talking to the military, when they're talking to men in the military, they are talking about condoms, especially as we're mobilizing for war. So there are a ton of posters created to reach servicemen during the war. These are just two examples here. The one on the left is more nuts and bolts of how to use both a condom, and also at this time they use a chemical prophylactic method that's sort of just like sanitizing your genitalia after you've had sex. And they're really pushing prophylaxis use on servicemen. Most of the posters are more like the one on the right, where they're using a little bit of humor, but they're like trying to remind them of stuff they probably learned about in some sort of brief sex ed class they may have had when they first started. And they're reminding them, you know, always use a condom, use chemical prophylaxis. If you can, go in fact to a prophylaxis station, you know, on base where a medical professional can also help you. So they are talking a lot about that, but only to military men during the war. Okay, some other limitations that are going to become more apparent, in particular as the US mobilizes for war. One, well, both are sort of related to stereotypes about immorality and hypersexuality, specifically of Black people and of sort of young women. And so on the one hand, a concern about the health of soldiers means there's more interest in kind of reaching Black communities, creating materials to reach Black communities and stuff like that. But there's sort of mixed results. Some materials created for Black audiences are sort of created with this assumption that Black people are not smart enough to like fully understand some of these concepts. And so we don't see it on these examples here, but a lot of time, for example, they're using the term bad blood instead of saying syphilis or gonorrhea or venereal disease. And they're not really taking the same way in other materials where they were really trying to explain how all the procedures worked and stuff like that. They're not doing that as much in materials directed at Black audiences. I would say this is more overt in materials created by like Southern departments of health, but not exclusively. Some materials are better, particularly when they were like asking Black people for input on these things and they were part of the process. But this on the right here is an example of a pamphlet that, you know, is showing a middle-class family getting tested. The content of this pamphlet is basically the same that you would find for a white audience. So they're not like making it extremely different because they're trying to reach Black people with these materials. Another interesting thing that you also see in these images is, you know, at the federal level, New Dealers were like Perrin were really pushing like we should be using more Black medical professionals in these clinics or different programs that are trying to reach Black communities. So you see that, you know, on the right here, there's a Black doctor. But, you know, this isn't happening everywhere. So as we see in this one on the left, you know, white doctors are overseeing VD programs in the South. And that's reflected in the image here. Okay, World War II, of course, also brought a ton of focus to women. And so a lot of the imagery that you see, sometimes in materials directed at a general audience, but especially in materials directed at servicemen, is this dangerous woman figure. So we see two examples of it right here, but there's a lot of examples from, you know, as we're getting mobilizing for war, 1940, 41 and through the war. So we see women, you know, in dark bars, dark alleyways. A lot of times they look sort of sexy, but that's supposed to be part of what's sort of scary about it, is they're sort of luring men in, right? And another version of this is actually what we see on the left here, which is she may look like she's clean or she's, you know, a moral person, or you might not think she's had sex with people, but she, you know, any woman basically can have VD. So there's a lot of like demonization of young women, an assumption that sort of all young women are sort of sexual and kind of waiting to have sex with servicemen and get them sick. Of course, on the right, this is a little more overt, where they're really equating sort of death and VD and the sexy woman. And then, of course, she's arm in arm with our enemies. So there's a lot of these sort of scary, negative, sexualized images of women, definitely in wartime. So this was something they were sort of trying to get away from in the 30s, but then it really comes back, you know, in full force as we're getting into war mobilization. Yeah. this did two things. One, emphasizing that basically any woman that might have sex with you, assume she is diseased. Also encouraged servicemen to, use prophylaxis every time. That's kind of the number one message to men in the military. So by saying you can never know, right, kind of assume any woman has disease, they're hoping to encourage men to use prophylaxis every time. The other thing is it helped justify sort of the over policing of women during this era. So like arrests of women for things like prostitution, but also just things like vagrancy and sort of those general vague things that the police use to kind of harass people. Arrests for those sorts of things go up tremendously in the war years. And then also the government builds this network of what they call rapid treatment centers. This map is a little hard to see, but these little dots and triangles and crosses are the location of these rapid treatment centers. Some of them were located in like a pre-existing hospital or something like that. Sometimes they built these new camps. A lot of times they repurposed like old CCC camps and then changed them over to these rapid treatment centers. And so basically, if you were arrested for something, they could test you. And then if you tested positive for something, they would say, okay, well, now you have to go to a rapid treatment center. They technically could not force you, but they could hold you indefinitely in order to like protect the public's health in most states. So a lot of women went not fully willingly to these rapid treatment centers during the war years. The government was a little bit surprised about this. And so in 1944, they created this really like rosy looking video that showed women going to the rapid treatment center, and it was like camp and it was fun, and don't they look patriotic in their little hats here? They really tried to present it as like a patriotic duty and something that was not a big deal and fun. But of course, you'd be gone from your work, from your family, you'd have to explain where you had been, all these sorts of things. So yeah, the government was a little surprised that there was opposition, but there was opposition. Some women tried to challenge it legally, but none were successful at this time. So this is, again, sort of a shift to that earlier idea of physically quarantining people that they had kind of moved away from, in the 30s, but are returning to now in wartime. In part because it was a strategy they had used during World War I as well, physically quarantining a lot of sex workers or suspected sex workers. But it has sort of a different twist, which is because they had expanded the infrastructure so tremendously in the 30s and they had all this federal money and they could set up these rapid treatment centers, it's sort of bringing together those old physical quarantine tactics with this new sort of modern infrastructure that they've created and these new, treatment protocols that had been perfected in the 30s and stuff like that. Okay. In conclusion, in the 30s, Perrin and his partners in the national campaign tried to create new meanings for venereal disease that moved it away from immorality, from illicit sex, from marginalized groups, and instead, like this poster here, tried to paint it as an infectious disease, like any other one, affected all types of people. And so they really tried to take the venereal out of venereal disease, take the sex sort of out of the equation to gain support for what had previously been a taboo issue. While they were successful with some of this, I think sort of temporarily, they created a lot of awareness and support. They definitely expanded the testing and treatment infrastructure in the 30s and the 40s. Simply trying to take sex out of the equation and not addressing some of these more complicated issues related to race, to gender, to morality, meant that, a lot of these old stereotypes and stigmas came back, and sort of the long-term effectiveness of the campaign is really mixed, I would say. And ultimately, as I've just talked about, resulted in some unethical attempts to, focus on women and people of color as sort of reservoirs of infection again. I think another important lesson we can take away from this campaign is that, they tried to sort of work largely within existing systems. And so when you're working within systems that are essentially broken without trying to fix them, or creating completely new systems, you can't change things, radically. And so, they needed to get the votes, they wanted to get support, but they really had to work through local and state health departments. They had to work, as I said, they had to sort of compromise with organized medicine. And so that resulted in some important limitations, and it just sort of like replicating some of the barriers to health that were already in those things, right? Such as segregated and inadequate care facilities for people of color, things like that. I think one of the other things is that, even though they were providing, free or low cost treatment and stuff like that, those aren't the only barriers to carrying out a year of injections weekly, right? So, they were, it was an important step, but ultimately it wasn't addressing like, can people take time off from work? Do they have to pay for the doctor's visit? All these other things that could be important barriers to people. So I think in terms of thinking about today, we're still having a lot of this kind of moral medical debate about things like health insurance coverage of birth control, abortion, of course, in the news right now. And we're also frequently debating over sort of the role of government in health, right? So, I think there are lots of different lessons, I think, but some of the big ones is like, for me at least, is trying to make these issues either all about sex or not at all about sex, which is kind of where we are now with Democrats and Republicans. It doesn't really work, I think, personally, because it's both things. It's a medical issue and it's about sex. And yeah, I think also in the short term, making compromises can help you in the short term, but in the long term, sometimes you end up where you were before. So I don't know. Yeah, I think ultimately for long-term change, there needs to be more like remaking of values and institutions. And unfortunately, they just quite weren't able to do that here in the 30s. And I think that's something we're still struggling with now. So yeah, that's the end. I'd love to hear comments and questions from our small group.
Thanks.
Thank
Those
you.
posters were great. Some of them I know, but some of them I had never seen. Those are really wonderful.
Thanks. Yeah, I love the images is really what pulled me to this topic. I love kind of 1930s posters and art and stuff. So I think
My joke is that I used to go on eBay and type in syphilis. So I had like the big stamp out one. I actually gave it to the people in Tuskegee, but I had that, and I bought vials of artemisinin and bismuth online.
Yeah.
Using class, anyway, it was for those of you who don't know me, I've written on this. So anyway, so I thought it was great. I thought it really captured the efforts, and Perrin is such a complicated figure, and I appreciate very much what you've tried to do with him, because I think it's really important not to make these guys into total monsters. And so the argument I often make when I talk about this is to say, not only should you not be him, but you should think about how easy it would be to be him. Especially talking to medical student audiences, because I think it's important to think about how they got so caught up in the importance of the battle. And so one of the things I try to argue is they think of themselves as, if we use the war metaphor, I think it's important to think about it. So I think part of it is I've argued that if you think of it as a war on syphilis, then they get to be the generals. In which case, like Eisenhower, he knows people are going to die when he organizes D-Day, but it's his job to win the war. So I think of themselves as these generals in which they have the right to order people to die for science.
Right. Yeah. Any cost to get the victory.
Because the war is more important. And so I think trying to think through how to help people not think about that, I think is really important. And I think centering on Perrin is really critical because he's so important. And he's so smart. I mean, he's really good. I've been through his papers 3 times now, and he's just amazing. I mean, he's a really smart guy and very well connected.
Yeah, well, and some of the things he says are really great and pushing the envelope in terms of trying to talk about, for example, health as like a human right, and stuff like that. And so, yeah, it's interesting because in some ways he's really trying to push up the boundaries a little bit and get the New Deal to be doing more related to health. But
right.
Yeah, at the same point, yeah, he did some stuff that
right.
has such a harmful legacy,
Yeah, it was really kind of, I was involved in 2 things where we took his name. So he's the first dean of the public health school at Pitt. And the main building is called Parent Hall. And so the dean called, we had a big program to discuss what happened with him. And they finally ended up voting to take the name.
Mm-hmm. Yeah, I saw that.
And the same thing for the American I forgot what it's called, American Sexually Transmitted Diseases Association had a poll of their membership because their big prize was called the Parent Prize.
Right.
And, as a historian, it's always hard because on some level, I wanted them to keep the name on the hall with a plaque that explained, don't take, it's too Stalinistic for me when you start, making people disappear. But on the other hand, the community was so freaked out about having his name there that it was like taking down Confederates, statues, same idea.
Yeah. Mm-hmm.
So I think it's complicated, but I think it's really important to think about why they thought what they were doing were right. And just thinking of them as just racist pigs is too simple. Much too simple.
So I was curious, given the notoriety probably in the last 30 years of the Tuskegee experiments, everything that you showed us tonight, Erin, seemed to have an air of confidence that they have a cure, that this is a curable disease. Shooting people up with arsenic and stuff, I have reservations, but I wonder, how on the one hand was there such an air of confidence from the medical establishment, and on the other hand, the willingness to engage in these horrific experiments that Susan has researched and written about as at Tuskegee. So how, and I wonder, because you're both with us tonight, how do you see these 2 pieces fitting together?
Yeah. Well, I think sort of a technical piece of it is one of the reasons they're really confident about syphilis control by like the late 30s is there had been some sort of studies and some work done to kind of figure out the best treatment protocol for syphilis. And so they felt like they had kind of gotten it right by like the mid to late 30s, like, the dosages and how long and everything like that. So there is sort of a real technical part of why they're like, yes, we can finally do this the right way. But I think the other aspect is that, and Susan can say much more about this since it's her focus, but part of actually why I think Tuskegee continued so long was that they were like, we'd never have another opportunity to do this because now, especially once they had antibiotics, syphilis is so treatable. And so it provided this weird justification for it because they were like, well, we're eventually going to stamp this out. So we would never have this sort of opportunity again. So they're actually kind of connected in that sort of way. But again, yes, Susan can say more about that, I think.
No, I think that's absolutely right. And there's a guy named Joseph Earl Moore, who's sort of Dr. Syphilis at Hopkins, and he's the one everybody looks to. And they're very concerned that, it's hard to titrate how much neo-orthophedamine and bismuth you're supposed to use. And so there are these constant studies of, we use this much and then we use that much. So I think that you're right, that Moore begins to really have an effect on them and everybody looks to him. And he runs when the NIH gives money in the BD division of the National Institute of Health, it's Moore who runs the unit, and they're the ones who fund the study in Guatemala where they're actually giving people syphilis because they're trying to figure out whether penicillin will work as a prophylaxis, not just as a secure once you already have it. And part of the problem was, as Erin said, when they gave out this cream that men were supposed to put on their penises and it burned. And as you can imagine, there wasn't a lot of compliance.
Yeah.
Right.
So they were really trying to figure it out. And also remember the 30s is when we start to get the sulfur drugs. So suddenly the things that people really completely died of very quickly are, I mean, we don't have the antibiotics yet till the 40s, but in the 30s, it's the beginning of this real faith, you know, as Erin said, in medicine and what it can do.
Yeah.
And so, you know, I mean, my dad was a small town physician and did some of the early work on research on penicillin and bacterial endocarditis in hearts. And he did some research on this. And I said, so what kind of informed consent did you do with your patient? And he said to me, well, I told the patient if they didn't try this new drug, they'd die. Now, you can't use that anymore as a way to try to test a drug. But my father wasn't lying, at least. You know, the patient's true bacterial endocarditis was a death sentence, right? And so, you know, this is all this excitement. So like in the 50s, my family, every time we got a cold, my father gave us penicillin shots. And I said, Dad, cold's a virus. You're giving me an antibacterial. Why are you doing this? He said, well, you might get bacterial pneumonia, you know, so I'm chasing around the house with the penicillin shot, you know.
Yeah.
So I think that generation, you know, when your patients weren't dying anymore, it was just very powerful.
Yeah, I think I mentioned it briefly at the beginning, but also like the 20s, 30s, and 40s, there's also a lot of pop culture about sort of heroic scientists and discoveries. There's a really good book by Bert Hansen that talks about this. And so it's like there's lots of Hollywood movies and comic books, and it's sort of like, you know, Indiana Jones, but like scientists making discoveries.
Think about Sinclair Lewis's Aerosmith, for example.
Right.
The 20s is a good example of it. Yeah. Exactly.
And microbe hunters and
right.
Yeah. So it's also kind of in the pop culture, you know, of like, doctors and scientists are like heroes and well respected, and we should really defer to them, you know, in all this sort of stuff.
Yeah. Right. Yeah. Exactly. Right. It's the joke is when does a fetus you know, in Jewish law, when does a fetus become you know, a real person? And it's when they graduate from medical school.
So Carol, please.
Well, I was curious about the artwork that you found, a lot of it from the University of Minnesota. Do we know anything about the artists? I mean, I assume they were WPA employed at the time. Did they go on in their careers and work on other medical campaigns, or do we know any names of the artists?
That's a great question. I do know some of the names. I haven't really done any like deep dives on them to find out. That's a great question. My guess would be, because a lot of them were, as you said, WPA produced, that they were just sort of, you know, they got assigned something and that's what they worked on. I don't really have any information about if anybody chose in particular, you know, I really want to do public health pieces or anything like that.
I mean, Bert might know, Bert Hansen might know, but I don't, he's the one other person, as you mentioned, who does this kind of stuff, but I don't know.
Yeah, I'm not sure. Good question.
And then do you know at the time, was there any need to have these materials translated into other languages?
Yeah, that's a good question. So I've come across just a few examples of that. I came across some in California that were, I'm not sure, it was for, you know, Chinese immigrants. I'm not sure because I don't speak any, you know, languages that they would be speaking. So I'm not sure what it was. And the archive didn't say specifically, you know, what it was. But there were some where they had basically, it seemed to me based on the images that they had recreated, that they were just taking a pamphlet about syphilis that like the US government had made and then translating it kind of specifically for that community. I think I've seen some also in like maybe on the East Coast that were in maybe like Italian or something like that. So there was definitely some effort to do some translating. I would say I've come across more in earlier eras on like anti-TB stuff. There was like a lot more of putting that into Yiddish and Italian and stuff like that.
Yeah.
So I came across a little bit, not a ton, at least for me.
Yeah, because we have at the Eastside Freedom Library flyers that were produced by the Minnesota Department of Health around COVID that are in Somali, Hmong, Karen, Spanish. So it, maybe we are a little bit better.
Yeah.
Well, the art isn't as good today as it was then. Amy, do you want to say something, ask something?
No, I'm just, it's really interesting to listen to the program and hear about, I had never seen some of the images before. I am a I'm a public health student myself. So I've read Bad Blood about the Tuskegee experiment. Known so much about what you were talking about, the whole national program against syphilis. It was very interesting, very enlightening. Thank you.
Thank you.
One other thing I just wanted to mention, if anybody else is, if you're interested in seeing like more of the images, I have like a digital archive that I made when I originally did this research. And so I'll just put the link in the chat.
Great.
Great.
So,
Thank you.
yeah, so
great.
Yeah, these are materials that, you know, the originals are in lots of different archives all over the place. But then I've sort of put them here, you know, to bring them together. So anyway, so you can take a look at that. There's also links to some, you know, movies from the era that were created by the government. So those are always really interesting to watch.
Great. Thank you. Terrific.
Well, like Carol, I was struck.
I have my, this is my Spirochete and my,
Great.
I was struck by how many you had found at the Social Welfare History Archives at the U. And were they spread across collections or were they all in a particular collection? The researcher in me wants to know.
Yeah, so yeah, and that was sort of a happy accident for me since I'm from Minnesota. And so it was a cheap research trip for me to come stay with my family and then do research at the University of Minnesota. So yeah, those are in a particular collection of an organization, still exists today. Today it's called the American Sexual Health Association, but at the time it was called the American Social Hygiene Association. And they're sort of the big national group that was doing a lot of stuff related to syphilis at this time. They had like a big national social hygiene day. They made a lot of materials. So yeah, the U of M has stuff made by them, but also they of course collected other things made by the government or what have you. So they have quite an interesting collection of stuff there. Yeah. A lot of it is digitized now also. So that's
great. That's really great.
Yeah, that's great. So let me ask you guys, all of you, do you think we're doing any better today? I mean, there was a piece, was it maybe today in the New York Times about, you know, whether it was CDC or individual state organizations sending mixed messages or unclear, you know, the numbers are going up, but the response from the health establishment is not as concerned or expressing concern as it was at the beginning of the epidemic. What the hell is going on?
I mean, I think partially it's hard to get people to care about stuff for a long period of time. And so I think one of the things that happened with this campaign was like people were really jazzed about it, you know, when parents started talking about it. And then the war kind of helped revitalize it. But I wonder if without the war to kind of revitalize people's interest, if people would have been like, yeah, whatever. And maybe the spending would have gone down. And especially with something like COVID, where it's like, we're dealing with it all day, every day. It's, you know, there's a lot of burnout in terms of people just wanting to hear about it or caring if they should be wearing a mask or something. I don't know.
Well, I think you also had, I mean, periods where people had been working together and affected by crises earlier, including World War I and then the Depression. So people were more unified than now.
Yeah, that's a great point too, is like, I think one of the reasons they were successful in the 30s is like, it wasn't politicized. Like there were some detractors, some Republicans, or as I said, organized medicine was a little like, wait, is this gonna, affect our bottom line? But like, it wasn't as politicized as so many of like COVID, of course, but also most of the sexual health issues have become so politicized that it's hard to have a conversation about a lot of them sometimes.
I would like to know, you focused a lot on the public information campaign to US citizens. How did syphilis and gonorrhea kind of find its way into American literature of the time?
That's a great question.
Especially in fiction.
Yeah,
I can see it.
I don't know too much about that, to be honest. I looked more at kind of like movies, I'd say. So there were, as I said, there's like one big Hollywood film where they're talking about this guy, Paul Ehrlich, who kind of developed the treatment that they're using at the time. And then there's a lot of kind of low budget movies that have syphilis as like the story. I haven't really looked too much at fiction. I will say though that a lot of the movies, like these low budget movies that were created in the 30s.
Are they the film noir, the B movies, like with Richard Widmark, or all the black and whites?
Like, well, they kind of fall into that genre of like exploitation films where they're talking about things that are like sort of a gray area in terms of if they can be shown, things that were about drug use or abortion. And so syphilis kind of fell into that category, but then it got a little more liberal as people are becoming more comfortable with it in the late 30s. But a lot of those movies are just sort of riffing on I want to say it was originally a book and then a play, or maybe a play and then a book from the progressive era that was about like a man who has sex right before he's married and then gets syphilis and then gives his wife syphilis. And
is it damaged goods?
Damaged Goods. There you go. Yeah, I couldn't remember the title. So Damaged Goods started off as I think a book, and then they may have done stage versions of it.
That's right, exactly.
They're riffing on it a lot in the 30s in these sort of low budget exploitation films. And they kind of vary a little bit. Some aspects of the story. I've seen one version where the main character is a woman, which is sort of interesting, but it's always sort of this thing of like somebody has sort of a misstep right before marriage and gets syphilis as a result of that sexual encounter, and then gives it to their family and is very sad. But ultimately, medicine helps and saves the day, and that's really the overall theme. Yeah, I would be interested to see how it played out in fiction. I just mostly focused on a lot of the visual culture, like comics and movies and posters and stuff.
Is this something that comedians of the time would have included in their acts, or was it just too sensitive?
That's a great question. Yeah, I don't know. Probably.
I mean, I tried to track some of the Tuskegee stuff in popular culture in my book, but so it shows up in poetry, so one of the Dick Gregory is one of the first Black comics who basically implies that syphilis is that the men were given syphilis in Tuskegee, which is not true. But that's there almost from the very beginning on that one. So it's in music, it's in poetry. I mean, some of that's in my edited book on the subject. So you see it around that, but I don't know anything about the 30s. It's a great question. I don't know if anybody's done think about all the other people who've written on the history, but I don't in John Paris Gondola's book either. I don't.
I think we look at COVID, we're going to see a lot of that in all areas.
Yes. Yeah, I think right.
Yeah, I mean, I think an interesting thing with COVID and pop culture is like a lot of television shows have sort of chosen to just skip over it. I feel like there's actually only a few shows that dealt really in a realistic way with like what happened. Like I think one of the few was this one called Superstore, and that was because all the main characters worked in like a Walmart, and so of course they had to talk about how that impacted them. but I feel like a lot of shows maybe have been skipping it over in part because people are tired of it or they want like a respite from COVID, you know, in their entertainment. But it'll be interesting as we get further away from it if people maybe return to it to kind of explore it.
I mean, it's a really good example. There's an argument going on right now. So the American Public Health Association is having its like 150th annual meeting in Boston this fall, and they're making it mask optional. And people are just flipping out about here's the major American Public Health
Good
Association,
Lord.
right? And they're not requiring masks for the meeting.
Oh,
Wow,
Like really nuts.
Yeah.
that's
Yeah.
wild.
Mm.
I mean, so, you know, and it's hard here. I mean, I just went to a meeting last night, a public meeting here. I'm in Wellfleet on the Cape, and I was the only person wearing a mask in the entire meeting.
Yeah.
Yeah.
Well, we certainly have that experience. Except at the East Side Freedom Library, we're still hardcore.
Yeah.
Everybody has to wear masks.
Yeah.
And,
Right.
but, you know, it's weird to be the conservative.
Yeah.
You know, it's weird.
You're the progressive on this, Peter.
Yeah. Well, Erin, thank you so much.
Very much. It
for
was
this.
great, Erin.
And I'm
Thanks.
Thank
so
you,
glad
Erin.
that you and Susan got to meet, and
Yeah, me too.
and hopefully there'll be more exchanges.
Yeah,
and-
please let me know, Erin, if there's anything I can do to help. Peter has my email, but you know,
Yeah.
just reach
Great.
out. I'd be glad to do anything
Great.
I can.
Great.
Thank you.
All right.
Yeah.
Inviting me. I
Thanks,
really
everyone, coming
Thank
on.
you, everybody. Stay well.
Take care.
Wear your mask.